Good morning. We're live. It is Thursday, not Tuesday, but we're still here and we're happy that you found us. Sue and I switched days this week. That's why you're finding Tuesdays with Kamyra on a Thursday. But we're going to have a good conversation on this Thursday. Today, we have Dr. Natasha Ramsey. She's speaking with us about sex ed for Gen Z. Yay. I know I say that because I want to get people pumped up. I know they're going, oh. Natasha, I'm going to tell you real quick about Natasha. She is a board certified pediatrician specializing in adolescents. And she is going to address us. I am all confused today, but I had written down. Are you questioning your ability to talk about sexual and reproductive health with your members of Gen Z? Dr. Ramsey says you can do it, and she's here to help. So that was my cute thing that I have to say. Want to let everybody out there who's watching know that Dr. Ramsey will answer your questions live on air, questions and comments. So if you have them, please post them in the comment section and she'll address them. If you are watching us on your own time after the live recording, she won't be available to answer your questions and comments, but you can dialogue with other people who are also watching a replay. That happens a lot, and I see fruitful conversations that way. So having said that, I want to say welcome, Dr. Ramsey. Do you prefer Natasha or Tasha? I saw both in our email. Tasha. Okay, we're going to go with Tasha. Okay, thank you for joining us today.
Thank you so much for having me. Hi, everyone. I am Dr. Natasha Ramsey, but I also go by Tasha, and I also go by Gorgeous Doc. So I am a board-certified pediatrician. I'm currently in training to become a board-certified adolescent medicine specialist. And what that means is that I work with young people ages 11 to 25 and help with anything that they have an issue with, including puberty all the way up to STDs, teen pregnancy, anything that a teenager or a young adult may need, I address as an adolescent specialist. I have an extensive interest and experience with doing sexual reproductive health education. That's actually how I got into the field of medicine and into the field of adolescent health. I used to write for a teen sexual health magazine when I was a teen, and ever since then, I knew that reproductive health was something that I needed to fight for. And so I founded Gorgeous Doc when I was actually in training still. Initially, it started out as a blog where I talked about like my feelings and what I was wearing today and what I ate, as most people do when they start a blog. But then when the pandemic hit, I was like, oh no, everyone's talking about COVID. Nobody's talking to the teenagers. Nobody's talking about sex. These teens are still doing it and they don't have any access to go and get care or don't know what to do if something goes wrong. And so I took to Instagram and I started to create content. I started to create videos, Instagram lives, and also some drawings to help educate teens about their sexual health. And since then, everything has kind of blossomed, and now here I am. So that's the truth of it.
You are with us, and we are so grateful that you are. Why don't we begin with defining sexual and reproductive health?
Yes, that is it sounds like an easy question to answer, but it's really not. So sexual reproductive health is a very broad term. A lot of times people think of sexual health education as preventing pregnancy and preventing STIs, but sexual health education is so much more than that. It's more than just like, this is the body part that goes in this body part, and if you have contact with this, then you can get pregnant. It really now has evolved into something much more complicated. We understand so much more about sexuality. We understand so much more about communication, consent, and all these other things. So when I think of sexual reproductive health, I think of what tools a young person or an adult. I get a lot of adults reach out to me about information, but what an individual would need to live and have a healthy sexuality and sex life. And so that is not just knowledge about like which parts go where, but also knowledge about gender identity, knowledge about consent, knowledge about communication, knowledge about what your values are, knowledge about the menstrual cycle and how it works, all these different pieces, pleasure, and all these things that are typically not covered in sexual health education curriculums that are super important and that young people need to know to make healthy decisions.
Okay. And why is it important for us to have these conversations? We want to have these conversations in our home in addition to the sex education
Yes.
curriculum that you mentioned.
Yes. So unfortunately, in the United States, depending on where you live, depending on how you look, depending on your income, the sexual health education that you receive it varies.
Mhm.
So we see that in many places in the country, people are learning sexual health education that is abstinence only, meaning that they're only learning about how to abstain from sex and not how to how to engage in sex in a healthy way, or even values around how do I communicate with my partner, etc. And so what we see is that the places where there is a lack of sexual health education, there actually are worse health outcomes. And by health outcomes, I mean higher rates of teen pregnancy, higher rates of sexually transmitted infections. So it has real implications for health by not knowing and understanding your sexuality and how your body works. And so unfortunately, parents cannot count on schools to do all of the teaching for them. A lot of sexual health education actually starts in the home, and it starts at a very early age with something as simple as communication and consent and naming body parts. So, for instance, a a school-age child should know that their vagina is called a vagina, not down there or a hoo-ha or a this or that. They should be able to name the body part the same way that they're able to name their arm or their leg or their ear or their nose. So those conversations need to happen at home. And the only way that those conversations can happen is if the parents feel equipped to answer those questions. And I talk to a lot of parents who themselves don't understand sexuality, don't understand sexual health. And so it's very difficult for them to then communicate with their kids about those things because they can't even use the words. So it really is important that parents have these conversations with their kids at home. And I hear a lot of people talk about their concern about children learning these things too early, that they feel that it's too soon. But sex ed is something that should be taught throughout the spectrum of your life. And it really should start at a very young age with those simple concepts of naming your body parts, consent. It is okay or not okay for someone to touch me, right? When you take your child to the doctor and the doctor is going to do their exam and they say, is it okay if I listen to your heart and lungs? And the child can say, yes, it is okay if you touch me. That is the kind of things that need to be taught to kids. So that way, when they become older and they become an adolescent, they can then say, no, it is not okay for you to touch me because they learned those skills when they were a child. So those are just some of the reasons why it's important that parents talk about it with their kids.
Great. I want to remind people you can ask your questions in the comment section. Just type them in and I'll see them and post them up and Tasha will answer them. But while we're waiting on that, tell us what it is. What should we be addressing? How should we be doing it? And what should we be saying to initiate these conversations and during these conversations? I mean,
Yeah.
you can't give us a script for every year of our child's life, but really help us out here. What is it? I'm at a loss.
Yes. So I think the most important thing is open communication from, like I said, from a very young age. And I think the best way to kind of open up these conversations is to using movies, books, situations that friends have been in, things like that, and normalizing things. So instead of saying, are you having sex? You can say, I know sometimes people your age are doing these kind of things. Like if you had questions, like where would you go? And then you feed them information. Here's a website that I saw that, I thought was really cool. Like you should check it out. And the kid might be like, oh my God, mom, like I don't want to talk about this right now. But they still hear you. And like I think the other important thing is we have to remember adolescents are going through a very difficult time. They are going through lots of changes, not only physically, but mentally. A lot of times people understand the transition that a baby makes from crawling to then sitting up to walking and from babbling to talking and saying words. A very similar parallel thing is happening to adolescents, and people fail to understand that their brain is literally developing over that course of that 11 to 25-year-old range at a very rapid rate. And so there are certain stages of development that adolescents are going through. And at those stages, understanding those different stages also help with understanding how to meet them where they are. So kind of, I know you said not year by year, but we could do stage by stage. So with the younger adolescents, they are very concrete. They are very, very concrete. If you say to them, you can't do that because you're going to get pregnant in the future, maybe, they're going to be like, I don't care about that. I care about prom tomorrow. Like they're very concrete and like in the right now. So it's important to, when you talk to them about things, that you talk to them about the right now and not necessarily focus too much on like the future and what could potentially happen. With the middle and also the younger adolescents care a lot about what their parents think. Younger adolescents are at that prime point where they really do not want to disappoint their parents. They really do care about your opinion. They want to fit in. They already feel like an alien. Their body is changing. They're like, oh my God, like I didn't have hair, now I do, and I didn't have boobs, and now I do, and like, what is this? But like she has boobs, but I don't, and like they're going through this phase of like feeling very awkward and weird. And so the best thing you can do is normalize things during that stage and say, you know, and talk to them about puberty. Your body's going through changes. This is what this means. You know, if you have questions about this, everyone goes through this. Like, you're beautiful or you're handsome or whatever words you want to use to reassure them that they are normal and that they are, you know, growing normally. Middle adolescence is when things get rough. At that point, they don't care about your opinion anymore. They care about their peers. They want to fit in. They're like, you know, they care more about what their peers think about them. And then also they're trying to find their individuality. They're like trying to figure out like, who am I? Who do I want to be? You know, they're testing the waters. They're like not quite, you know, at the point where they're now independent, but they want to be independent. And so they're testing these things, but they still need you and they still value your opinion, but not as much as they do their friends or their peers. And then they get to the older adolescents, and now this is when they're like about to go off to college. This is when they like kind of know who they are. They're like, you know what? I am who I am, and that's what it is. But they still need you. And they come back around to caring about family and what the family thinks and what their parents think and what their parents, you know, their expectations of their parents. They found their individuality. They care less about fitting in. They have a tighter knit group of friends. And so there's, you know, during those different stages, you just have to understand where they are and kind of meet them where they're at. So with the younger kid, you may need to be very concrete and say like, let's talk about sex. Like, let's talk about anatomy. Like, do you know what your body parts are called? Like, here's some resources where you can read more. Like, the middle adolescents, you might need to pull back a little bit and let them kind of figure out what it is that they need from you and come to you when they're ready. And then the older adolescents, they may really value your opinion and what you have to say. And so making sure to keep that door open. The last thing that you want to do, the other thing I will say is, as a adolescent doctor, a part of my job is to figure out what kind of things adolescents are getting into, what things are dangerous, and what things that I can help mitigate or risks that I can help reduce. I have had a lot of parents who do not want to leave the room when we ask them to leave the room to do a further assessment about these things. And I will tell you that is a detriment to that patient, because our role is to identify those things and help mitigate those things. You may not know what those things are right in the moment, but that's okay. Because if it's something dangerous that we think your child is at risk, we will tell you. But if it's something where we can help them to find their autonomy and make the decisions for themselves, then we will help guide them through that. And the best thing you can do is leave the door open for them to communicate. And we always encourage our young people to talk with their parents. But by being in the room when we're trying to have that conversation, you're stifling them from being able to tell us and discuss with us some of the concerns that they might have. So I know that was a long, drawn out answer, but
that's really good. That's really good, because you answered some of my follow-up questions. So that's two doors that you mentioned. One is the real door at the pediatrician's office, when I think usually it's around age 15, your parents are asked to step out.
11.
Please do that. Please do that, is what you're saying. And the
Even
other door,
yes, at age 11 is when I kick parents out.
Okay, 11%. Okay. And then the other door is the metaphysical door, keeping the door of communication open. So
Yes.
the communication door open, the pediatrician door closed when they ask you to please exit. They will bring you back in.
Yes, exactly. And also, like, if you feel like, you know, you're not kept in the loop, you can always communicate with your doctor and say, hey, like, I know you kicked me out, but like, what's the plan? Like, what's next? Not all people will close the loop and say, like, we talked about a lot of things and things are going fine. some people, sometimes they forget to update parents. So don't feel free to be like, hey, I just wanted to check in and make sure there's like nothing else, any other concerns, like anything else. Not all people will kind of close the loop on that. So if you feel like you're not being involved enough in the visit or in the encounter, like definitely speak up. But I do kick parents out at age 11 because the reason why I do is because teens are going through puberty at age 11. There are young women who are menstruating at age 11. There are young people who are having sex at age 11. And so even though people don't believe that, and they're like, oh, 11's way too young, it's happening. There are people who start their periods at age 9. And so at the point where someone is in puberty or going through puberty, they need that alone time with the doctor to be able to talk about the different things that might be bothering them, that they may not feel comfortable talking to their parent with right away, and make sure that they're doing the things that are keeping them safe. So I look at it as like we're an extension of you guys. We're gonna get the information out of them that they may not want to tell you. We're like the cool aunt. Like, look at us.
I like that. Your pediatrician is the cool aunt. We have a couple of we have some. I want people to know that we see your comments. We have comments from Christina and Lori and Stephanie, and they are really enjoying this. They like the points that you're making, and they are telling us what's been helpful. So at the pregame, and you mentioned it here, you mentioned that we have to meet tweens and teens where they're at. So now we're talking sex ed. Tell us where they're at. We're the parents, like you said. Yeah. We're not the cool aunts. Where are they? So that we and what should we be talking about? Specific topics. We're here. We want to have these conversations. The door is open. We want them to feel comfortable. But what are we supposed to be talking about?
Yes, that is a great question. So I think what we have to remember with Gen Z is that they are different than generations prior. So I'm a millennial. Proudly a millennial. So I was around before there was social media. I was around before there was all this access to internet and to each other. So, back in the day, I used to be on the phone and my mom would pick up the phone and be on the phone trying to hear my conversation with my friends. Kids these days don't have that problem, right? And so it's just a different world. There's access to information in a way that we did not have before. So young people are seeing all of this information. And unfortunately, some of it is accurate and some of it is not. And it's really hard for them to filter through what is real and what isn't. I've had patients who have tried things or done things that they have seen on TikTok or seen on Facebook or seen on Instagram. And they were like, well, someone said, and my friend said, and this, before it used to be you would hear it from your friend. Now they're hearing it from some stranger that lives miles away on the internet. So adolescents are on the internet. That is where they are seeking their information. And it's so easy. They can go on the internet and Google, I don't know, anything, and it will come up. And they can read about it, look at it, watch videos on YouTube, all types of things. And so adolescents are on the internet. And so it's important that you talk with your adolescent about safe internet use. And also you teach them the skills to identify what is real and what is not. So you say, okay, let's talk, let's look up, and it could be anything. It doesn't have to be sex ed. It could be any topic. And you say, let's do this together. Let's look up information about blank. And you show them, okay, this website is not a trusted website. Why? Because who wrote this blog? When was it written? Where are the facts? Where is the data? So you help them understand that not everything that they see on the internet is real. And I think that that's a great exercise to do when they're in that earlier adolescence and very concrete and looking for like concrete answers about like whether or not they're normal.
Okay, we have a comment. We have a comment I'm going to get to, but before I read it, I want you to think about this. So we have two specific scenarios here. I remember being in a car with a middle school son, and it came up that he was talking about a specific group of young men, athletes at the school, who were being offered oral sex just as prizes from other middle school girls. So that brings up the question, when do you start talking about your things like oral sex to your children? This was middle school. The other thing, and again, this is middle school. In my area, there is a whole controversy about a middle school where a sex act, middle schoolers performed a sex act, filmed it, and uploaded it. So there are a lot of conversations that have to happen clearly before middle school, during middle school, and after middle school. So I want you to think about that while I put up this comment, because those are concrete things that parents are dealing with, right?
Yeah.
Oh my gosh,
Yeah.
what should I be saying and what haven't I said? And is it too late? But first, we're going to hear from Stephanie. She says her son is 15 and not interested in dating, but has wanted to change his clothes and cologne. He wants to build his self-esteem because he feels he's not good looking because of acne, but he's handsome. I'm 100% on board with his feelings and I'm there for him. Sounds like you're doing all the right things. And if he's starting to do the clothes and cologne, I think the dating's coming.
And I will also say, you know, like I said, adolescence is a time where you feel strange. And you're like, I don't know who I am. My body is changing. Things are happening so rapidly. I feel like everyone else is progressing and I'm not, or I feel like I'm different than everyone else. And so I think that is some of those feelings that he's having are normal feelings. And the best thing that you could do is continue to encourage him that he is a great person, not just because of how he looks, but also because of his strengths, because of his, you know, who he is as a person, and just continue to support him in that way. He will get through this phase. And the other thing I will say is he may still be exploring his sexuality, and it may not be that, and he may be dating. He just may not have told you. He may be, you know, it may be that he's interested in girls or interested in people that he has a crush on and people that he likes, but he doesn't feel the confidence to talk to them yet, things like that. So I think the most important thing is that you continue to instill that confidence in him that he is a great person, no matter how much acne he has on his face or whatever things or changes or transitioning in his body is going through. And then I would say also bring that up to the pediatrician. So as an adolescent doctor, and as a pediatrician, I treat acne all the time. And people a lot of times will undermine acne and be like, oh, it's just acne. But for some people, it can be really distressful. And there's plenty of options. There's lots of treatment. So I would say if that's something that really is bothering him, that is something that you could talk to your doctor about to help build his confidence. But also continue to instill in him that it's not just about how you look, it's also about who you are as a person. And having those conversations about, like, when you do like a girl, like, how would you talk to her? Or when you do like a person, like, what would you say to them? Like, what are you looking for in a partner? I often will ask my patients that, and you'll be surprised the kind of things that my patients will say to me. I'll ask them, like, what are you looking for in a partner? And they'll be like, I want someone who's funny, but also kind. And these, you know, teenagers are awesome people. They have lots and lots of like insight and opinions. And like, it'll be great to like have that conversation with him up front before he starts dating. And also providing information about, like, you know, if you do start dating, that's something you can talk to me about. I'm here for you. But if you don't want to talk to me, because I know that might be awkward for you to talk to your mom about dating, like, here are some resources and some websites you can check out. And so planting that seed, dropping that information, so that way when they are ready, they're like, oh, wow, she like handled that way better than I thought. And maybe I could talk to her about that. So just like planting those seeds now, before he starts to date.
So let's get back to the real specifics. We need to know what they know. So what do they know? What terms are they using? And how can we structure our sex ed at home conversations around that and address those things? And we're running low on time, short on time.
Yeah.
I want to make sure that we get that in, that someone who's looking for concrete things, like, if your community has a middle school sex video scandal, or if you're driving down the street like I was and your son starts telling you about the athletes receiving oral sex offers in middle school.
Yes.
And
so
beyond.
I think it's important. Like I said, there's lots of information on the internet. And also some teens know more than their parents do about sexual health. And I will also say that the adolescents, these Gen Z is woke. They are woke. So I ask I have older adolescents that I work with and younger adolescents, and I will ask the older adolescent, like, what are your pronouns? Like, what is your gender identity? And they're like, I don't know what you mean. What do you mean by that? And I ask like the 12-year-old, and they're like, they and them. Like, they like just know it. They're just like, they and them, she and her. Like, they understand sexuality in a different way than we did because they have access to so much information. So I would say
we teach them. I'm sorry to interrupt, but you made a good point. So they understand it in a different way than we do. So how do we get to where they are so that we can have these good conversations?
So what you need to do is gauge what they know. You have to gauge what they know, because if you go in assuming that they don't know anything, then you number one, you may offend them because they're like, of course I know about that, you know? So
Yeah.
I would say start out with what they know. So for
Mhm.
this, for example, with this situation with the students that were being offered oral sex, an easy way to breach that conversation is like, wow, like, how do you feel about that? What are your thoughts about that? And then your child might say something along the lines of, well, oral sex is still sex and you can get an STD from oral sex. So that's not safe, you know? And then you're like, wow, I didn't know you knew that. So it's important for you to like not jump in and be like, oh my God, I can't believe the kids are doing that. Like, what is happening? Like, you can't panic. You got to stay cool and calm and collected. And you have to say, oh, well, what are your thoughts about that? Like, what do you think about that? Like, what do tell me, like, what have you heard about that? And then you could say, then, depending on what they say, you can like course correct, or you can reassure them, like, like, I think, even though people think that oral sex isn't a big deal, like it does still come with some risks. And, a lot of people don't know, but it's important that you use protection and blah, blah, blah. And you use it as an opportunity to teach. And you're not directing it at them, right? So the last thing you want to do is be like, are you doing it? Like, you don't want to do that. That's the last thing, because then what they're going to do is they're going to shut down and they're going to be like, I'm never telling her anything again. But if you come at it very calm and you're just like, wow, interesting. Like, what are your thoughts about that? Like, has anyone offered you that? Like, what would you say if somebody offered that to you? And then you get an idea of like where they are, and they get to talk it out with you, and then they see your reaction. Teens are always looking for your reaction, and teens are the kind of people that are very sensitive. And if they feel that it is not a safe space, they shut down. They will shut down. They do that if they go to a clinical space and it's not safe. If they go to a organization and they feel like it's not safe, they will shut down. So it's important to keep the lines of communication open. And you have to realize that you're not always going to, every moment is not going to be a moment where they're going to divulge everything to you. You have to take things as you get it and use opportunities to teach and remind them that you are there for them no matter what. And so you may not get out of them the information that someone offered it to them, but you can use that as an opportunity to say, to teach them that this is something that could be unsafe, and also comes with other things like emotional attachment and these other things that you may or may not be ready to deal with. So you don't want to close them off. You just use it as an opportunity to teach.
Okay, so I love what you just said. Emotional attachments. We want to discuss that because that's part of sex ed. And of course, we know each child is beautifully unique, so you have to gauge your own child. But when do we start discussing emotional attachment? When do we actually start describing the sex act? Like you said, you start asking them parents to leave the doctor's office at 11. I'm assuming that we should have already had the mechanics of sex before then. And what type of hypotheticals to elicit information are good? For example, I did, and maybe this was bad, but with one of our sons, I said, oh, I've been watching this series. There's a lot of sex on this series. They're all doing this stuff. And, I said stuff, and I said, don't give me any names, and I don't want anyone's personal information, but do you know of people doing anything like this, or anybody in your crowd sexually active? I don't want to know. And the immediate response, and I share this because it worked for me, but you may decide that it was not the right way to go. And I want parents to know that in case they're thinking. He said, define sex.
That's what I'm saying. The teens are.
I was like, how about this? I turned it on him. I'm like, you define, what do you think sex is? You define it for me. And because we went back and forth. But so exactly when should we be having the mechanics talk? When should we bring in the emotions talk? What happened for us and what happened with a child who's older may not be for the child we're thinking of right now.
Yes, that's a good question. And like I said, it's a conversation that should be had throughout the course of their childhood. So I know a lot of people on this call right now are parents of adolescents. And so you're like, shoot, I missed the opportunity. But it should happen very early on. Children, sexuality is a spectrum that develops over time. It's not like they turn 11 and they're like, okay, now I'm sexual, now I have a sexuality. It's something that develops and it's building blocks and things that build over time. And so these conversations about liking someone, having strong feelings towards someone, that all needs to happen way before puberty, because, how many of you have had like a kindergartner or a young child that was like holding hands with another kid, and then and they're like, oh, they're like in a relationship almost,
Mm-hmm.
So kids can develop these very strong feelings for each other very soon. And so those feelings about emotions and about friendships, it's not just about romantic relationship, friendships as well. I don't know how many of you have had teens who have went through a breakup with their friend. It is very, very stressful. So adolescents are having these very intense emotions and feelings towards each other. And even prior to that. So the conversation needs to happen much earlier. And that's why it's important to identify values and identify what is it that you would be looking for in a partner? Like, what's important to you? Like, what is it that you like about that boy that you like told me that you have a crush on? And then you'll identify what their values are and understand what they're looking for or what's important to them. And then you can instill other things that are important. And then also remind them of their values so that they don't end up dating someone who is not worth their time or not worthy of them. So it's an ongoing conversation from very young all the way through adolescence, even past adolescence. So how many of you have friends who, you're like, how many times I have to tell my friend that she's better than this guy? Like, she needs to leave him alone, All of those things stem from when they were very young and like not having those conversations with, their parents or with other adults in their life. So I would say it starts it starts before the adolescence. And it's important to continue fostering. What are your values? Like, what are you looking for in a person? What do you have to bring to the table? Like, having them identify what their strengths are, what they bring to the table, what their values are. Like, all of those things are super important in sexuality and sex education, because a lot of times people will do things because they don't understand their value, right? They're like, oh, I like this guy and I want to keep him, so I'm going to have sex with him because that's what I have to offer, instead of understanding that they're a smart, beautiful, funny, whatever person. So it's important that they understand their values so that they can bring that to the table when they are starting to date.
Okay, so that's an important part of the sex ed conversation. We do have to talk about the mechanics.
Yeah.
Hold on, but I want to remind them that what you're saying is make sure we wrap that around our family values, our cultural values, and then you, young person, establishing your own values, because those things are important parts of sex ed beyond mechanics. We're going to hit mechanics right now.
Yes. And with the mechanics, the thing you have to remember is the mechanics, they can look it up online. They've already seen it. They've already looked it up online. Like, before they're coming to you to have this conversation, they've already seen it. Like when you talk to your son, he's like, what do you mean by sex? Like, what does that mean to you? Because he understands that sex is complicated. It's not just the penis and the vagina. It could be multiple things. And so the kids already know some of the mechanics. It's important for you to review the mechanics, obviously. But the thing that you can contribute as the parent is making sure that they have the values and making sure that they have the access to information, and that they have an open line of communication with you. Because the mechanics, you can easily say, here's a website, look at this, let me know if you have questions. If you want, we can talk more about it. But the part that they're looking for from you is that guidance. They're looking for you for that confidence, for the values. Like, I don't want to let my family down. Like, I don't want to, they're looking, that's the things that they're most concerned about from the parents' perspective. But I think opening up the lines of communication and saying, we can talk about this whenever you want. Here are some websites. What do you know already? What do you want to know more about? I know that you might not be comfortable talking with me about this, but you could talk with your aunt, whatever, like offering another adult that they can talk to about it. I have a niece who we talked about everything. We talked about everything. She was like, wait, so where does that go? And how is that? And this and that. And like, we talked about all of it. And she has an open line of communication with her mom. But there may be things that she doesn't want to ask her because she's like, I don't want her to think that I'm doing blank or that I want to do blank. And so sometimes it takes a village. You may not have every single conversation with them, but the most important conversations you're going to have with them are about instilling those values and instilling that confidence in them to be able to, communicate with their partner, ask for consent, things like that. So I think a lot of times parents stress and they're like, I have to teach them like A to Z, everything about sexual health. And like, that's not necessarily your role. Your role is to make sure that there's an open line of communication so that if anything goes wrong, they know that they can come to you. If they have questions, they know that they can come to you. If they're worried about something, or they're in an abusive relationship, or, you know, they're worried that they're pregnant, they can come to you. And so I want to empower you all to not worry so much about the mechanics, and worry more about like the softer skills that are typically not taught in schools. That really does have a benefit coming from the parent, as far as like confidence and things.
I love that. Not worry so much about the mechanics, but the softer skills. That's what we need to be giving them at home. And also to remember that they probably already know the mechanics. You want to ensure that that what they know is correct, because
exactly,
all the information may not be coming from reliable sources. But I'm telling you, when my son told me about oral sex when he was in middle school, my memory was in middle school, I kind of knew what it was, but I didn't believe that people actually did it. Like it was something, but people wouldn't really do that, right? And he knows people who have done it in his middle school. So that's a whole, and I'm not saying in my middle school they didn't. I'm just saying me as a middle schooler.
Yeah.
Another thing that I and people in my crowd have found helpful is because of the internet and cable TV and everything, we are seeing all kinds of sex and entertainment, not just porn, but all kinds. And so I think that part of our soft skills conversation is letting them know that that's not real.
Yes.
They should not be emulating that. So that's part of the sex ed conversation. Not that you're going to give them a how to do it, but just let them know that they're not supposed to be living up to what they see in entertainment.
Absolutely.
That's part of it.
Absolutely.
You brought up consent. Consent is wonderful on both sides of the equation, no matter what's happening, that people should give and receive consent as often and make it fun.
Yeah. Yeah.
And one thing that we didn't talk about, especially those of us caretakers of older teens, but it could be younger, as we just discussed, letting them know that if they've tried it and they decide that they're not ready for it, you can stop. Because one of the things that happens is people try it for whatever reason, and there are myriad of reasons, and they don't want to do it anymore, but they figure, oh, well, I'm no longer a virgin, so I can go ahead. Let them know that it's okay, and it's not a big deal. You can just stop.
Exactly.
You tried a food, you didn't like it, and you want to stop.
Exactly. And I think also understanding who you are, understanding your body, understanding your values is very important. And a lot of times teens are still trying to figure that out. And so what I encourage them from the mechanical standpoint is understand what your body, how your body works. Understand what's normal for you, what's not normal for you, what feels good to you, what doesn't feel good to you. And that way you can communicate that with your partner. And a lot of times adolescents don't even know what their body parts look like. They've never even looked down there. They don't know that there's different holes. They're like, oh, like I thought that the pee came out of the same hole as the blood. And like, they're just really confused about just like some of the mechanics of their own body. And so I always encourage people, get a mirror, take a look, know what's normal, so that when something goes wrong, you know that something is wrong and that you should seek attention or like reach out to, your parent or a doctor. So that's another thing that you can encourage your kids to do, is just to learn their body and understand their body and what's normal for them. And a lot of times, once again, during adolescence, they're feeling like an alien. They're like, one of my boobs is bigger than the other. Like there's something wrong with me. And it's like, that's actually normal. A lot of people have different sized breasts, or I've had patients come to see me because they thought there was something wrong with their genitals. They're like, my labia is like bigger, different than like what I saw in the porn. And it's like, that is your labia. This is what your genitals look like. This is normal. It's a normal variant, and it is normal. And as much as possible, and they'll come with their parents. Like I've had people come with both parents, mom and dad, because they thought there was something wrong with their labia. And I'm like, this is completely normal. So just like normalizing, understanding your body, understanding what's normal for you, and then when something is different, when to seek help.
Understanding your body is part of sex ed. So that's the thing that we should be discussing with our wonderful. I have already said plenty during this conversation, but I want you to tell us, if we have one takeaway from this conversation, what should it be? The one thing that we remember, do, put on our to-do list, or share? What should that be?
Yes. What I want to say is You are not in this alone. That's what I want to say. Do not stress. Do not fret. You are not in this alone. A lot of times parents are like, oh my gosh, I have to tell them, I have to do this. I have to teach them this. You have to remember, once again, they're doing their own research. Before you even talk to them, they've already learned about some of these things. They've learned about some of it in school. They're talking about some of it with their peers. They're seeing it all over social media. They're seeing it in movies. They're seeing it in shows. So they have some understanding of some things. And your role is, once again, the softer skills, making sure that they understand their values, making sure that the line of communication is open, making sure that you understand sexuality and sex ed, because once again, there's a lot of parents who themselves didn't learn a lot of this stuff. So educating yourself so that you're able to help them if they do have questions or they come to you with a concern. And also being transparent about, like, I've never heard about that before. Let's learn about it together. Or let me look into it and I'll get back to you. Like, that's also fine. Using your network. So aunts, uncles, other trusted adults, coaches, other people who your child finds as a resource or someone that they feel comfortable talking to, and understanding that they may go to them and talk to them before they talk to you. And using that as an advantage, and saying, like, if you can't talk to me, that's okay, but you can always talk to your Auntie Tasha if you have questions. I just want to make sure that you know that we're here for you no matter what questions or wherever comes up, and that I will always love you no matter what. And then there was one other resource I wanted to mention. And then your pediatrician, your doctor. It is literally our job to identify if your child is engaging in anything that is risky or dangerous or that we need to intervene with. And a lot of the time when we kick you out of the room and we're talking with your kid, we're educating them. We're like, this is what's normal for your periods and this is what's not normal. Are you having sex? Are you using protection? If you're not using protection, do you know where to find protection? Do you want to start birth control? Do you understand how birth control works? Do you understand some of the side effects that come with that? Are you depressed? If you're, we're trying to figure out as much as possible and gather as much information as we can to identify if your teen is being safe. And so we are all in this together. You're not in this alone. Teachers, everyone that has a touch point with your child is all a part of this journey that your child is going through. And so the best thing that you could do is continue to instill your values in them, be supportive of them, open lines of communication, provide them with resources and say, hey, you may not want to talk about this now, but when you do want to talk about it, I am here, so that they know that you're a safe person to come to. So I know I gave you guys a lot of takeaways, but the main thing is you're not alone. You're not alone. And you can always I'm available over Instagram if you guys ever have, or by email if people have like specific questions that maybe I wasn't able to answer. And I know that you guys do a ton of discussions around this topic, but reach out to your network. That's what this is all about. You're not in this alone. There are going to be tough situations that require a little bit extra work or a little bit extra support, but for the most part, like, you have a network already. It takes a village, and like, lean on that village.
You're not alone, and your teen is part of your village. So we have posted some resources, and we're going to post some more resources because we have some that we've gotten from Tasha that we're going to post. So when we go off the air, we're still going to post a couple of resources. So be sure to come back and check for those, and hopefully they will be helpful to you. We are done for today. Unfortunately, we could have gone on and on about this one. Thank you so much. This is valuable information. Everybody who's watching, come back tomorrow. Tomorrow we have coffee with Jen and Sharon. They are always a lot of fun. They are coming at it from the parents' perspective, and they tell it like it is. We want to hear it that way, and you want to dialogue with them. Thank you so much. I'll be back next week on Tuesday, and we'll have another great discussion. Bye-bye.
Bye.